Hello friends, are you suffering from pain under your cap? Is there a pain which is suddenly today or just at night arise and you're wondering all these years the cap was doing so well? Why is this pain all of a sudden? Or you are finding that your old cap is now become mobile and giving some different sensations, or there is food lodgement besides your cap. All these problems can be sorted. How? Come, let us watch today's video and we will know what exactly is the solution for this problem, or first let us know what your problem is. Come. Hello and a very happy morning to all of you. Here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shaham. So friends, as we are discussing today, let us first know a very simple and a basic thing, that if there is a pain in all the teeth, or there has been pain suddenly which has been arising, and plus you have some sinus issue or cold issues along with it, then you need not worry, because once the sinus or the cold goes off, this pain in the cap or all the above teeth will just go off. If that is clear, then we will move on to a real pain thing. Okay, now remember, a cap can be a single cap, a two cap, or it can be a teeth which is under your bridge. Okay, so all this week in simple whole terms we will call it cap. Now how under your bridge you have removed one single tooth from your bridge, right? Supporting sides are your real teeth, and with that support you have fixed up a cap. So the real teeth which you're taking as a support are the caps. So in this whole video, all this is considered and said as caps, and the teeth are considered as teeth below the caps. Okay, now there are many permutations and combinations and many issues that can arise below your to the teeth in your cap. Okay, so let us very simply, in simple terms, I'm going to make you understand today. Let us understand it. Tooth, on that there is a cap. The tooth, it can be root canal treated or it cannot be root canal treated, right? Very simple, clear. Okay, now if the tooth is root canal treated and still there is pain in it, what happens is we're going to see. Okay, in that the surrounding teeth, if there is a decay, then you need to treat the surrounding teeth and your issue will be sorted. But if there is lot of food lodgement happening, or there is pain in the root canal treated teeth, then you need to have a proper solution for it. What is the solution? Keep watching the video till the end and I'll tell you about the solutions for it. Now, you will tell me that the tooth is root canal treated. It should not really have pain. You're very right. But there are certain time chances that there is some micro leakage, there is some fracture, there is some tooth decay, there is some missed out root canal or some lack of procedure. That time the microorganisms reinfect the tooth and there is a uprise of pain in your root canal treated teeth also. So now this is very clear. Sometimes there can be infection below your root canal treated tooth also. Then again, this is because of the same reasons, leakage and microorganisms which has triggered that tooth. Okay, so now let us move on to the second option. Now the second option, in which the tooth was not root canal treated. Here lies an issue because the tooth is still alive. It is still having sensations, right? So it can be anything from tooth decay to tooth fracture to some root issues, some infections underlying which has been suppressed since a long time and that has come up. So anything from this needs to be treated. Now if there is pain plus there is pressure, there can be a tooth infection. If the tooth is mobile, that it is moving slightly and there is pain, then it can be fracture. And if there is food lodgement under the cap and you are neglecting that since a long time, then that can be tooth decay. So different reasons, different solutions, right? So now, if there is a lot of food lodgement that is taking place, then the surrounding tooth can also have a decay, and even that can cause a tooth pain. Okay, so both the situations understood. Now you check in which situation you fit in. Okay, now you have analyzed everything. Done. So now what is the solution for this? The solution for this is only that you remove the cap, get the tooth treated, and again refix the cap. That is the correct and the perfect solution. Now, if the tooth was earlier root canal treated, that there are chances that it is having less chances of retreatment. The tooth might just not be possible. It might just not be possible for the dentist to retreat the tooth. Yes, if it is the back molars, then it is definitely possible. But the front tooth, because the surface area is already very soft, there has been since a long time, the tooth was alright, it suddenly shoot up the pain, then there are very less chances. Then, if the tooth is having fracture, which can also be a case in root canal treated tooth also, let me tell you, but that will not cause pain. And we are specifically speaking about pain in this, pain under the cap in this episode. So, if it is pain under the cap and the tooth is fractured, then you need to check what kind of fracture it is. If it is a vertical fracture, the tooth is broken down, then extraction, removal of the tooth is the solution. In other cases, like the tooth has a decay or the cap has been spoiled, there has been food lodgement issues, and the tooth is in a good state, you can treat it. Definitely a root canal treatment can be done. Now, how would you know what exactly has happened? So, one thing, remember that an X-ray is very much going to be important analysis for the diagnosis. That exactly the tooth is having an infection or that is surrounding teeth. To exclude the surrounding teeth issue, we need to have an X-ray. But now the tooth which is having a cap, you cannot really peep through an X-ray also inside a cap. So once the surrounding teeth issues are excluded, if still the pain is persisting, then we'll have to have a cap removal and then only check what is going to be a treatment plan. Now you will say, what, I'll have to also remove my cap, and if the tooth is not treated, then how is it going to be beneficial? It is as in not going to be beneficial. Here or there, you have to remove the cap. Okay? So, now how much time will this take? So, removal of cap will take you one visit, then the diagnosis and everything else. Then you might just, if there is a tooth fracture and the dentist is not able to know what exactly is there, then they will suggest you a CBCT, which is going to take one more visit. And then 3 to 4 visits for the root canal and final cap fixing. So in general, you will take 6 to 7 visits to the dentist and the problem will be solved. Are there any other ways to solve this? I would say not really. There are a few, but I wouldn't like to discuss it here because it depends completely on the patient and it differs from case to case. And it will be a lot of confusion for you to know if I discuss it here. So, yes, there are a few other options also available, but this is the most commonly used and the most commonly preferred option by your dentist. So, friends, if you have any other questions related to the problem of your cap and the pain below it, or you have any other issues related to your teeth, then please mention it in the comment section below and I'll definitely solve it. I'm sure by watching this video, you have cleared your query and got the solution of what can be done of the pain under your cap. Now, do make sure that you visit your dentist quickly and get the treatment, because the more the delay, the more the damage to the teeth, and then I'm sorry to say, but the more the delay you do by eating painkillers and antibiotics, the more damage to the teeth is done, and then at the end the tooth has to be removed. So if you want to save the tooth, visit your dentist quickly. If you have liked my video, then give a thumbs up, press the like button here, share it among your friends. Do visit my channel Dr. Mansi Shah for more dental related issues and get happy solutions for it. I am a dentist practicing in the city of Pune. Here is my email address. If you have any query, please you can mail me also and we can have a one-on-one talk. Friends, wishing you all a very happy and a bright smile. Stay healthy, stay happy and stay over fit. Thank you.